Is it considered regenerative medicine when they do that process where they put someone else's poop in your butt?
It should be.
Right?
I haven't seen that called that, but it should be, right? Because we're correcting a system, right? I don't think they look at the microbiome as a system like they do the musculoskeletal system, et cetera. I imagine eventually it would fall under there.
What's that process called?
Fecal transplant.
Mm-hmm. Okay.
Yeah.
Why are you so interested in this?
Well, it just made me think like, well, it's natural. It's regenerative.
Well, and it's not, they're not putting something in your butt. Like you're swallowing a capsule.
I did not know that.
Yeah.
I didn't know that either.
Yeah. Fecal transplants are.
I thought it was like essentially like a dissolvable pill that you got to whoop.
No, you get to
okay.
suck some shit down.
Literally.
Yeah. Yeah.
Sounds like a Saturday night for
Bill.
Chris.
No, Bill was really hoping for the other approach, I think.
Well, but you know what? If Bill really has this anal kind of fixation, we can just get him set up with, a trans anal ultrasound.
I thought you were going to say beads.
What you guys do on a Saturday night is not our business, Liv.
How dare you take my joke?
So can I I'm asking a rhetorical question.
You're going to get an out loud answer, though.
Yeah.
Okay.
But I'm going to ask one that I know I'd like to comment with you on this.
Oh.
So you're talking about
So
these.
Chris wants to pontificate.
I just want to talk more.
I want to ask a question and then I'll answer it myself.
Yeah. That's kind of how I roll. Because then I know the answer. So a lot of people, there's some drawbacks, some perceived drawbacks and potential drawbacks for using stem cells versus the acellular products like Wharton's jelly and exosomes. Can you talk about kind of the analogy of the kid in the bad neighborhood type of thing?
We'll get there.
Okay.
Yeah, so we'll get there. We're not there yet.
Gotcha.
Yeah.
Teaser. So why don't you shut up and sit there? Your opportunity has now been wasted. Damn it.
Yes. And then the things that PRP is most often used for, a lot of joint reducing of joint inflammation like osteoarthritis. They also use it very heavily in the aesthetic world. So the vampire facelift, where they're injecting your PRP back into the skin.
Adrenochrome.
That is not it.
Have you heard of that?
No.
Oh, dear Bill.
Okay. Never mind.
Well, now I need to know.
I believe it's baby blood.
Oh,
Or something.
yeah.
It's
They're
baby
they're-
adrenaline.
Yeah, that too.
yeah. Well, how are they getting that from the babies?
That's the bad part, I think.
Yeah, no. And so that actually kind of brings up a really good point. When we're talking about like the Wharton's jelly and we're talking about the exosomes where most of them are coming from placenta, these are sustainably harvested. They're from live births, right? So these women have gone through, they don't want their placentas, they don't want the umbilical cords, they're donating them to whomever. And then they're being harvested. So this isn't coming from dead babies. It's not coming from abortion houses.
Sure.
This is...
Because I have heard that, I think.
Yeah.
That's
These are not where these are coming from.
And they screen, all these products are screened from these labs like meticulously for any infectious disease.
Yep.
All kinds of stuff. So there's a big protocol in all these labs that make sure that everything is...
Is the PRP the one that's used a lot on spine and discs and stuff like that?
They are. I think that some of the earlier uses have been for that. That requires a bit more skill. Chris and I attended a conference a few years ago where a group of doctors, they do a lot of this regenerative medicine, predominantly PRP. Like I've never heard them talk about anything other than PRP. And, they're talking about injecting it right at that disc space area. And there's, but those are more ultrasound guided. But yes, so PRP is used a lot there. I think there's better therapies like the acellular Wharton's jelly or the exosomes that might offer more benefit than just the PRP because of more of the factors that are associated with those two products than just the PRP.
I see.
PRP is also used a lot for, too late for you, hair restoration, as are exosomes and other sexual wellness type of rejuvenation. So around the clitoris, around the penis, to help with erections and sexual
blue pill kind of thing, like more sensitivity or something like that.
Increased sensitivity, increased erections. For the guys, it is injections into the shaft of the penis itself. It's numbed your pussies.
How do you numb that?
A cream,
But
a topical
it
lidocaine.
penetrates.
Yep.
Oh, okay.
Penis is a very vascular area. It numbs up very well. And then also
Flaccid on the mind.
Hey,
after you get stuck, there you go. And then of course the other ligament tendon things for PRP.
Okay.
So to get to your question, Chris, about the bad seed. So when we talk about these practices, a person will come in and they'll say, hey, I want to get these therapies done. And you kind of go through their history and you're like, okay, well, what is sleep like? It's pretty shitty. Are you drinking? Oh, yeah, I have, like a beer every night. What's nutrition like? It's pretty crappy. And so here we are doing something, putting something, you're spending your hard-earned money to put a good seed into a bad environment. And it's not going to work well. And so that's the other thing that some of these research studies don't address is that, when I first started learning regenerative medicine, nobody shared any of that with me, right? They just talked about, here's how you do it, here's the frequency with which you do it, here's what we should expect. One of the other conferences, the Seed Scientific, the cellular medicine conferences that I really like to attend, they really talked about that environment and getting the body ready for this. Like when I have my patients come in now, like they have to stop drinking for 4 weeks before they come in. Otherwise, I'm just not going to do it. Like, let's just get rid of these other things that are causing underlying inflammation, so that this works better.
To like literally medicine in general,
right?
Like,
so
it's kind of what separates people that are going down the path that you've gone with your clinic and others that have done similar. Is like it's not just 15 minutes in and out. It's Let's talk about what your lifestyle is.
Right.
Because whatever I give you, kind of like, what's that Dr. Zawardian, the weight loss thing?
Oh, yeah. My
600-pound life.
Oh, yeah.
He makes them prove that they're going to make lifestyle changes before he gives them their gastric or whatever surgery.
Right.
So they got to lose 150 pounds in 5 weeks or whatever it is. To just prove that, like, okay, I can give you the surgery, but you're probably going to die from it because you're going to just eat the normal amounts. You're not going to change anything in life, and then nothing's going to happen.
Yeah, and if someone came in to Carrie's clinic with like uncontrolled type 2 diabetes and wanted a knee injection like with exosomes, they're inflamed. Their whole body is systemic inflammation, and the likelihood of that's going to work is drastically lower.
Interesting.
Yeah. So we had, and I won't mention names, but we had one of our fellow practitioners came in and was asking, like, hey, I got this really bad shoulder. I can barely do my job. I'm concerned. He went and got it MRI'd. It was a pretty significant MRI of his shoulder, and they're talking about surgery. He's like, well, I can't take the time off for that, right? And so we've done a series. He's done 3, and he's really good now, of the exosomes themselves injections, spaced about 4-ish weeks apart, in which we injected right into the shoulder area, and now they're doing their job just fine. They're doing jujitsu just fine. But that money would have been wasted, or he may have gotten a suboptimal result if we didn't say like, okay, well, you got to straighten up your sleep and you got to stop drinking for 4 weeks. And then let's talk about that at your next appointment, and things are good. Then we'll go ahead and start an injection. But these therapies, again, they're not just one and done, right? Like sometimes we need more than one. There was a recent research article where they looked at hyaluronic acid, P.R.P, and ozone therapy for osteoarthritis in a knee. And they looked at a 1 month, 6 month, and 12 months. Within the first month, ozone kind of stole the show, right? So ozone helps reduce inflammation. People feel good. But then after that, the 6 and the 12 month, PRP really kind of stole the show there over the other two modalities, because it actually, it put growth factors back in there to help reduce inflammation, to help kind of restore some of the natural architecture within that joint. So, people expect too much out of medicine because we've gotten to a point where, they can go in and get the painkiller, right? And that painkiller is takes their pain away and they're good, right? Or I can take some NSAIDs and that takes my pain away. But that's not correcting the underlying issue, which is this low-lying chronic inflammation that's most likely coming from a lifestyle.
Well, and even worse, what they're doing is they're still injecting corticosteroids into people's knees. And we've known for years that damages cartilage. So it reduces inflammation locally and makes them feel better temporarily. But not only are we kicking the can down the road, but we're making it worse. And a paper just came out this year kind of showing again, long term, that it's accelerating arthritis in the knee.
And that's what they inject a lot of athletes
all
with.
the time,
When
and
they
they're
have
still doing
injuries.
it. And insurance covers that, right? They also cover hyaluronic acid, which is Synvisc or Euflexa or these other things, which is just basically a lubricant in the joint. So it's not doing anything because they know that they'll cover. You can still get, I'll need to get, it's almost like an oil change, right? Where I'm going to go every certain amount of time and get it topped off again, where it's not really doing anything to improve the joint itself, much less corticosteroids, which are making the matter worse and accelerating arthritis to make people more likely to need like a knee replacement.
Because there's a small bit of benefit for the steroid. But
Symptomatically.
Right.
Yeah.
But it's actually on the back end damaging and
Yes.
creating more issues.
And we've
down the
known
line.
that for years. And it's just, it infuriates me when I see people going in. I've had them, I'm going in for another corticosteroid injection in my shoulder, knowing that it's weakening the tendons. It's disrupting and killing cartilage.
Well, it's
over time.
fascinating because I know in the NFL they use that a lot when guys get
Dude,
injured.
NFL is just trying to keep people on the field.
Right.
They
And
could
then
care less about their
when they
long-term
retire,
health.
there's guys that can barely walk
They're
in their
jacked.
mid-30s.
Yeah, and that's just a crime if you ask me.
Yeah.
Interesting.
So
But-
anyway, I digress.
Yeah, no, but I mean, it's this system-wide inflammation that's causing the issue to begin with, right? And then we have to do something to fix it. And even the steroid use. So the gentleman that I was talking about, one of our teammates, okay, you got to cut back on your steroid use too, because we need this little bit of,
Well, talking about
NSAID use, not
NSAID,
steroid,
I was gonna
NSAID
say,
use, yeah. We've got to cut back on that NSAID use because we need a little bit of inflammation to kind of spark some healing, and then let these things kind of take their place, and do what they need to do locally.
Hey, Carrie, real quick, just for people, we use the word NSAID all the time. I mean, it's non-steroidal anti-inflammatories like ibuprofen, naproxen, that kind of thing. is what she's
Tylenol,
talking
yeah.
about. Not Tylenol, but
Oh, yeah.
I did not know that.
Yeah.
yeah.
Another thing that I really like to use as far as the regenerative medicine practices go is you can combine therapies, right? So when I was talking about using exosomes, and I'd reached out to one of the representatives about getting some, because I needed some new supply, and okay, what's the cost now? Because everything's gone up. He's like, oh, well, what are you using for a matrix? I'm like, well, I'm not. And so he was a little surprised because some places like to add in a little bit of hyaluronic acid or something like that to help keep it localized. You can inject it with like the exosomes with the P.R.P. or the stem cells with some P.R.P. Just to kind of keep things more localized to the environment. But I've had good practices without it. And I think adding in something peptide-wise like BPC 157, which is Body Protective Compound 157, very generic name. There wasn't a fancy doctor to name it. Typically, it's found in the juices of the stomach, the gastric juices, but they found that when they've isolated this, that it has tremendous healing properties, things like ligaments, tendons, corneas, etc. And what that does is it starts to recruit growth factors into that area to help those things heal. So even if people didn't want to pay for like P.R.P. and they're like, well, if you can inject yourself locally with some BPC, which we gave you for your toe also, that helps bring growth, that helps bring in factors for healing that are super beneficial overall for the process. So,
and we use that on my capsulitis. Was that what it was called?
Your toe?
Yeah.
Basically a overextension of my big toe.
Well, you had a capsular sprain, which turned into the itis is just the inflammation.
So we had to Olivia injected into the knuckle, basically, the big knuckle. And then, I healed from that much faster than I thought. You guys gave me a couple months, like, hey, it's going to be a little bit. Same with Jonathan, foot specialist, foot effing master. And
doesn't tickle or nothing.
he got his technique down and everything. And it did. I mean, I would say even faster. And we were a little shy on being daily, but towards
That's
the
on
end.
you.
Yeah.
Okay.
Yeah.
And then you used it on your adductor that.
I use a bunch of stuff. She actually
Yeah.
gave me IV exosomes. She gave me BPC injections. So
You just did the whole gamut.
and I healed. I mean, I was, in my 50s with a big adductor tear, and I was back on the mats in 8 weeks.
Yeah.
which is
And that was gnarly. I mean, your whole back of your hamstring and the inner thigh,
Which is
when I
black.
examined it, was literally black.
from the blood.
The
yeah.
bruises. Yeah.
Yeah.
Well, Bill likes to examine things
Yeah.
from time to time.
I gotta check
Just
it out.
check it
Yeah.
out.
I got to get in there.
Yeah.
Carrie, I have okay, so this is like kind of superficial question, but also not. First is, can any of these help with calming down like an autoimmune or even healing an autoimmune disease?
So most autoimmune diseases, and that's a really great question. So MS, right, is an autoimmune disease, and type 1 diabetes also an autoimmune disease. And so they're looking at things like exosomes and stem cell therapies to help with those for sure. What I think is really going to be coming out, because it's slowly starting to come out in research now, is we really got to work on overall gut health, right? Because that's the area where our largest impact of the immune system really is. And so we're going back to, what does diet look like? What does sleep look like? What's causing an underlying leaky gut for you? Helping to heal that and putting your gut microbiome into a more favorable population. And sometimes just doing probiotics isn't good enough. Like we talked about on the gut talk, those probiotics have to get through the most acidic environment in the entire body, which is the stomach, to try to get to where it needs to go. So doing things more food-wise, like prebiotics, prebiotic fibers, fermented fibrous foods. No, kombucha and yogurt don't count because we need the fibers, are super helpful in putting that immune system back in balance.
Yeah, you guys should go back and listen to our episode on gut health that Carrie did.
Yeah.
Because it can basically kind of help to put those autoimmune diseases in remission.
Right. And so when they're looking at like those autoimmune conditions, they're doing more IV therapies with those.
Okay.
Yeah, because you guys remember that most of these things are triggered via were theorized intestinal permeability, exposing, the immune system in the gut to things that it's not supposed to see. And it kind of has a cross reactivity called molecular mimicry, basically then sets up a whole section of immune cells that are now attacking your tissues. And they think the trigger is that most of it is in the gut. Yep.
Okay. And then my second question, this is more the superficial. As far as like anti-aging goes, on the surface, like skin or whatever, usually people do Botox or other things like that, fillers. Is that something, because you're saying that that guy was able to use a topical exosome to completely fix the burn. So does that mean people could use that for wrinkles?
So, yes. The caveat to that is, how deep are those wrinkles and then how do we best get it into the system? Excuse me. So when we're thinking about when we think about things like the vampire facelifts, et cetera, not only are we injecting into those wrinkle areas, but we're also typically doing like a skin pin where it's a micro abrasion of the skin, and the skin pin over skin rollers, and I can touch on that in just a moment, and allowing those growth factors to seep down a little bit further, but just getting a topical solution to put on your face. That gentleman that had the burn already had open tissue, right? So, but yeah, regenerative medicine for anti-aging is huge. It's huge.
Well, if you think about it, Botox is doing nothing but paralyzing facial muscles. Where these things like the facial P.R.P, we're trying to stimulate collagen production. I mean, because a loss of collagen in the face in general is what happens when we age, kind of the sagging phase.
Due to a loss of our hormones.
Well, again, it's a holistic type of thing, right? But these things are trying to stimulate more collagen production through an inflammatory process is what P.R.P in the face is actually doing instead of just paralyzing facial muscles, right?
Okay, well, now this just leads me into, so Carrie, if women and men do hormone replacement therapy as they get older, are you saying it will slow down the aging process?
Yeah.
On your skin? Really?
Yeah, it's
everything.
It's no big surprise. So when I went through medical school and we were talking about, okay, here's what you look like when you're 30 as a female when we were doing the GYN class, the gynecology class. Here's what you look like when you get into menopause. We have thinner hair. Our hair becomes more gray. Our skin becomes more saggy. Our breasts become more saggy. It's a whole cascade of things. And I don't think they really understand what that connection is between the healthy hormones and everything else in the body. Also, not a big surprise, and this is definitely due to the effects of estrogen and testosterone on bone health. Women become osteoporotic. We have higher incidences of breast cancer sometimes, if it's not the genetic forms, when we get older because of the loss of hormones. And it's not necessarily the hormones themselves, even though they like to tell you that it is, because your hormones aren't killing you right now, are they?
Yeah.
But when you lose them, then all of a sudden you lose some of the protective effects.
Remember the definition of a hormone, it is a cell signaling thing that actually produces gene expression at the nuclear level in a cell. So it is signaling a cell to do stuff. And when it's gone, I mean, whether that is proliferation of collagen, making sure your osteoblasts and osteoclasts in the bones are doing their job appropriately. So it's no surprise when that signal is taken away, you start having issues, right? And that's what a lot of it is. That's why we're really big on, and Carrie especially has gone to a bunch of classes on optimizing hormones, especially after menopause for women.
Yeah.
Yeah, it's really important.
Okay, one more aesthetic question. Sorry.
You're okay.
So if that would help with like skin or whatever, would that also mean like, how you lose color in your hair as you get older? If you put it into your scalp, because you're saying it could help with hair loss, would it also help with generating hair color?
I'm not sure about that answer. I'll have to look at that. I do think that keeping things optimized minimizes that change to going gray, right?
What causes the hair to go gray?
It's a loss of the melanocytes. And again, how the hormones actually play into that, I'm not sure.
Oh, okay.
But it's, but doing hormone optimization, doing some PRP, like the whole hair restoration. Chris has something coming to him he's not aware of just yet.
Oh, congratulations.
Yeah. To see, but things like topical BPC should help maintain hair growth, hair color, those kinds of things if we're
Interesting.
reducing inflammation.
I'm fine just shaving it off. But
Yeah,
I guess I don't know
that's not
about
true.
what she's
She
talking
doesn't
about.
want you to look like Bill.
No, I don't care. I think it'll be really sexy. But, if I'm going to recommend something, I'm not losing my hair.
Right.
So,
She's going to put it on me.
Yeah.
and
But
see how
he-
it works.
Yeah.
He
I
cries
like
that
this
night.
idea.
yeah.
Yeah, see?
Yeah.
And if it doesn't work,
And
oh well.
if you lose
Yeah.
more hair after
Oh,
taking it,
oh,
well,
well.
that's okay.
He's trying to act like he doesn't care.
I don't.
He doesn't.
I don't.
I don't believe nothing.
Yeah.
I don't believe a damn thing you're saying.
Yeah. You're just bitter.
I mean,
Yeah.
some call it
But just back to the whole more aesthetics type of PRP, right? So like on Amazon, you can pick up all these derma rollers. So one of the plastic surgeons that was at one of the conferences that I attended for regenerative medicine was really talking about don't get the derma rollers because they run along and they drag the skin and can leave more like lacerations. Whereas like in my office, I use Skin Pen, which is more almost like tattoo-like. So it's just punctating the skin without causing very specific damage without an extensive damage that you can get from
you're
like
not-
the derm rollers.
You're not getting like shear stress then.
Yeah.
Okay,
Yeah.
that makes sense.
Yeah. So how this affects us in jujitsu, we have the one case of our fellow teammate that needed shoulder stuff done and now is rolling just fine with shoulder stuff. The hamstring issue or the adductor issue that you had, Chris, certainly was helped by some regenerative medicine practices.
The Wharton's jelly you injected into my SI joint.
Super helpful.
Big time.
We're not quite there yet, so I only did an injection about 4 weeks ago. It's
Right.
time for another injection, but what percentage of difference do you think that you've gotten?
80% improvement.
Right.
Yeah, and that's been chronic for like a year.
Yeah.
And I've done,
That's your frozen shoulder?
No, that's
my SI joint. Remember, I had that. I had a hard time playing guard for
Yeah.
a while.
Yeah.
Yeah. So that has been.
Daddy's
a lot
learning to lock his legs again.
Heck yeah, he is. As a kid.
So
And then my toe.
your
That's another
toe,
one, yeah.
elbows that we talked about all the time, right? Fingers. So all of that can be helpful. And you can think about like, okay, where do I want to start? We can start with something as simple as BPC 157, but you got to nut up and inject yourself.
Right.
And some people don't like doing that.
It's subcutaneous for the most.
It is, but when you're doing it every day,
Yeah.
you get a little needle sensitive, a little needle weary. They are showing that does have some migratory properties. So like, let's say you got tired of injecting right around your toe, we could go a little further down on the foot and it still migrate to where it needs to be. And they've shown that with the exosomes also, that it migrates where it needs to be. They've done some radio label studies where they've looked and like they've injected a mouse's tail to see where it goes. And they had one mouse that had a significant bladder infection and all of the exosomes went just there to heal that. So,
If I can recommend, if you're gonna try it, the BPC method, and you gotta inject yourself, and it's a joint, ice it, ice the heck out of it, get that thing as numb. Ice it longer than you think. Also,
well,
but that was what I did with my joint.
okay. Yeah.
It was just to make it numb.
Yeah. But there's also something about that prolonged icing of things.
Yeah, you're going against what you're trying to do.
Yeah.
Oh no!
You're reducing inflammation to the point where it can be counterproductive because
Even for that moment, like you're just doing it for you're icing for like 10 minutes just to get it.
It's probably okay, but some people will just like, oh, they injured their back a year ago and they're still icing it today.
Sure.
I'm like, well, that's not really healing, but that's fine. But maybe
meant
get
just for the injection,
maybe get a
though,
little biofreeze or something just to zap that.
It did help. With the. We weren't doing the subcutaneous though. I think we were going like pretty deep in there.
Well, there's only so much tissue you have around that toe, so yeah. And you didn't get huge needles, so you weren't going.
There were
I wasn't going crazy.
And
I was bold.
From a practical perspective, BPC 157 is a lot cheaper.
Oh,
than going like the exosome route because, I mean, the cost to your clinic when you just get them is substantial for exosomes.
Right. So right now my cost for exosomes just to put them in my office without the shipping charge because it has to come on dry ice, they're $1,000 a vial.
Yeah.
Wow.
The Wharton's jelly, the acellular is $600 a vial.
Right.
Just
cellular is $900 a vial just to get them in.
That's the clinic cost.
Yeah.
Right.
Holy smokes.
So P.R.P, like that's your own coming out of your own body, but there's still a cost of
huge process.
Right. Yeah. Like the kits themselves are $300 for that extraction process. So, these things aren't cheap. I get it. But they can certainly help with healing, get you back on the mats, and save you potentially from surgeries.
I'd like to bring up a point to backtrack a little bit because people are they hear about stem cells because it's in the news and they don't know what exosome is, right?
Yeah.
So there are some potential disadvantages to using stem cells too, where you put because if you look at a cell, it can get programmed by its environment. So let's say I have a super inflamed knee that I've been dealing with for years. Sometimes putting in stem cells there, they'll start to take on the characteristics of its surroundings, like putting a good kid in a bad neighborhood to be influenced. And sometimes the stem cells can kind of be co-opted by the environment to an extent, and they may not have all the benefits we are hoping for at times. Where an exosome is this tiny little signaling molecule derived from stem cells. So if we took if we took the essence of a bunch of good kids, right? And that sounds weird. And then that little signaling molecule will not be influenced by the environment. And it will go signal one of those cells, let's say a cartilage cell in your knee, like, hey, here's some good signals. Right. Mm-hmm. So there are some advantages of the exosomes. They're not so susceptible to the local, what we call the microenvironment. Well,
they have a lot of their own components to it. So exosomes have their own RNAs. They have their own fat cells with them. They have their own proteins. They have their own growth factors. Like there's a bunch of things when we talk about this product called exosomes that really kind of help stimulate the environment. And the nice thing about all of these modalities is there's really no downtime, right? Yeah. So, I injected your hip on like a Friday night and then Saturday you were rolling. So there's no downtime as opposed to surgeries.
Yeah, for sure. I would probably argue if you injected P.R.P. like in an elbow, you should probably kind of wait a week, maybe. Depends on what it is.
Well, I mean, if we're talking about that, either the medial or the lateral epicondylitis, just, continue to wear the brace to offload the tendon to allow it to heal.
That's true.
But you don't have to stop life, right?
Yeah, exactly.
So I had my hip replaced in 2017, right? I was out of jiu-jitsu for 3 months. Yeah. So.
That was right when I started. Mm-hmm. I remember you were just.
Yeah.
Like you were around, but you weren't really training.
Yeah. So. That's to me that was a huge layoff, right? So
and to talk about that case, we actually went to a guy that does stem cells and talked about, hey, what about doing this on her hip? And this is what an ethical doctor will do. This guy said, you know what, we could try it. But what I've seen in clinical practice and what the literature is showing is that for whatever reason, hips are not really responding as well as like knees do.
Well, and he also was like, well, he was willing to do the stem cell procedure, only if we went to Panama, where he was allowed to then allow them to proliferate into something that would be more compatible with the hip itself. And we weren't prepared to make that.
The U.S. will still not allow, they consider that excessive, quote unquote, manipulation.
Yeah.
Like growing out, taking your cells and growing out populations.
Yeah.
And you have to go, that's why places like Tijuana and Mexico and Panama, there's a bunch of folks that are operating these clinics, American doctors actually, out of those places because they can provide what they consider a better product for you.
Yeah.
So, Carrie, how would someone, let's say, who doesn't live around here, so they can't come and see you, how would they be able to find a good clinic that's not gonna just inject them with something that they don't necessarily need and take their money? Like, is there any way that, or any recommendations of how someone might find a legit clinic?
So one of the places that I would look is the Seed Scientific Group, right? So they do a lot more functional medicine. There's providers throughout the world. So that's one of the conferences where there's people attending from like Italy and London and all kinds of places. But they should have a list of providers that can talk to them about like peptides and health and all of those other things. The DO group, what are they?
Oh, the osteopathic prolotherapy group.
They have a really good group. They're mostly P.R.P. prolotherapy, but they're a really good ethical group also. Some of these others,
I mean, we have some in our area locally that I think are completely unethical.
Yeah.
And we're not gonna blast them, but they absolutely are unethical.
Yeah.
The Seed Scientific Group that she's talking about, Dr. Seeds is an orthopedic surgeon, super brilliant guy that's kind of been her mentor. She's actually a fellow in that organization now. But I think that would be a great resource too.
Yeah.
Kind of looking at their website.
Yeah. Yeah. So it's hard. It's hard to pinpoint just like go here. But yeah, like if you Google it, you'll find a dozen clinics probably in your area. Just ask the right questions, right?
So you can maybe, if you Google that kind of stuff, regenerative medicine, P.R.P, whatever, and then go to their website, kind of look for the association with some of those groups. I assume maybe you'd put that on your website that you're part of the fellowship.
Some of them won't, right? Because of the advertisement, I'm doing stem cells, that can lead people to think like, oh, the FDA may come and take a look at them. So some of them don't. Yeah, some of them don't. But go ask questions, right? Have a first appointment. If they're telling you they can fix absolutely everything and you don't have to do anything in your life to change it, probably a waste of your money. You may get some benefit, but you're not going to get the benefit that you would get if you did some of the hard work with it. So being healthy is not easy, right? We've got to work. You've got to sleep, get good sleep. You've got to get good exercise, good nutrition. Like you can't just put shit in and then put something expensive and get a rose. So
yeah, that makes sense.
That's good.
Yeah.
Good question, Liv.
Oh, well, thank you.
And I'm happy you're on this podcast.
Oh, thank you.
She is indeed an integral part of our podcast. Those savages that are listening that don't give her credit.
yeah. That's all I got, you guys. Any questions?
Oh, really?
Yeah.
Oh, geez.
Is that too short?
That took me off guard.
Would it help for people who are having like exosomes? Would that help for people who have spinal issues, like maybe a bone, maybe there's stenosis going on, or?
So that probably
like a narrowing of like
probably not.
Yeah.
Okay.
Because that's something else that may be inherent that's going on, and typically you just kind of I think, unfortunately, at this point, as far as my understanding goes, have to wait until surgery is needed where they can just open that space up. That's a fairly easy surgery with minimal recovery, again, if I'm correct.
Yeah, especially with some of the modern techniques. We have a local surgeon that's excellent here. He's also a martial artist. And I send a bunch of patients to him. When you have something called, when you have foraminal stenosis or central stenosis, meaning that foraminal stenosis is where the nerves that are exiting the spinal cord itself through a foramen, which means a window, the degenerative changes are such in the spine that window is so narrow that it's compressing the nerve. And no matter what kind of, stem cell or whatever you put in, it's not going to change that structure. Right. And so that's the point where they can do foraminotomies and all different kind of things to it depends on, and then if you wait so long where if you have severe degenerative changes, at some point you're looking at, more invasive surgeries, unfortunately. But yeah, that's, but a lot of that comes from also some of it, there's a genetic component, but a lot of it is preventative too, where, regular exercise and maintaining the stability and strength of the muscles that are surrounding the spine is super important, like anything else. Because if you're just hanging on your spine all the time, you have very poor muscular support, of course it's going to degenerate faster. Or if you're a smoker especially,
Shitty diet, shitty lifestyle.
Right. So, yeah, that's a good, but yeah, that unfortunately I don't think would be much use with regenerative medicine at this point.
Okay.
What are... because there's going to be people that are considering maybe getting some sort of evasive surgeries or something like that. But then they hear this podcast and they're like, well, I've heard of that stuff. Sounds like it could be an option. Do you think maybe they don't have someone trusted in their area? Could it be a benefit to buy the plane ticket to some place that they know of that's good? Not saying people need to fly up to you, but if that was an option, or if they knew they had a friend or a family member or something, they found a clinic that's a state away that is a part of the Seed Fellowship and stuff like that. It's like, okay, I feel like I trust them. They have good answers. Is that going to be worth the plane ticket to?
That's up to them.
Yeah.
Another of our teammates has a thumb issue, and we were just talking about it recently, and I'm like, they didn't have good options for them. And so I'm like, I would go see Dr. Seeds, right? They don't live in the state. They come up, they visit. So I think it's worth going and seeing somebody that has a little bit more knowledge and say, like, what really are my options? Like, am I stuck with just a fused thumb, or do I just give up my practice, right. of jiu-jitsu? So if it's within your budget, it's at least worth having the conversation in a first consult, and then making a decision from there.
And, some of these places will do telemedicine too.
Oh, yeah.
As long as you have, they have appropriate imaging they can look at and kind of stuff like that. So there's that as well. Even like big organizations like the Mayo Clinic now has the Center for Regenerative Medicine, believe it or not. So, they're popping up when they see, these big medical centers. Some of them, they're forward thinking, like Cleveland Clinic, Mayo Clinic. Some of them are like, okay, yeah, insurance isn't covering it, but I think this is a service. There's enough behind it we need to start offering to our patients. And usually those are like orthopedic surgeons and sports medicine doctors that have gotten into regenerative medicine as well. So
You've touched on this briefly, but downsides of this stuff, negatives. I get, nothing's perfect.
Right.
So cautious tales, if you will.
There's few downsides. However, the biggest one for most people is cost. It's not cheap.
Right.
But then physical downsides, you can always get someone that just has a bad reaction, even though like the exosomes and the Wharton's jelly is very strongly screened and we shouldn't have any contaminations. You can still get an inflammation, an excessive inflammation of the joint that could take a very long time to heal. or I've actually seen one person where I don't know where they got the injection from, got an injection into their knee, and the last time I saw them still had some knee pain, still had some joint swelling. And so those are the bigger thing. The biggest medical thing is, especially if we're injecting a joint and we're not super careful, is infection of that joint. So when I do it, I make sure that I use the same prep they would use in the operating room. I have sterile gloves on. Like it's, even if it's just like a finger, like I treat it as sterile as possible because we don't want that to get infected.
Why didn't you use gloves when you did a prostate check with me?
First of all, you said you like it natural. The latex allergy was the second issue.
Guilty on both.
And then I really wanted to make sure you felt the knuckles.
She's got jiu-jitsu knuckles.
I do.
You know, if you put 2 fingers in, it's a second opinion.
Mm-hmm.
I'd like you to stay out of my personal life, Chris.
Hey, so one more thing that is to back to your question, maybe a potential downside. It's rare, but there is some concern with stem cells in particular that they could form. They could have what's called neoplastic potential. In other words, unregulated cell growth, and contributing to cancer formation.
Yeah, I was going to say.
And so they're always when you put a stem cell that can grow into anything, depending on what the environment is, theoretically that could then form a nidus to start developing an uncontrolled cell growth. Although I think it's very, very rare in the literature. It's still theoretically possible. I think where something like exosomes and P.R.P, you don't have any of that concern.
I see.
Yeah. So,
I mean, that's all I have. I don't know if you got anything you want to.
No, I was shut down earlier. I'm quiet.
I have a random question. Sorry.
Ooh, you'll get a random answer.
Oh, good.
Ring it.
What causes osteoarthritis?
Ooh.
Or arthritis?
Great question. And so, going back to some of my more recent lectures, just over this last year, or conferences that I've attended. So we're right back to our entire favorite, gut health. Because if there's low level leaky gut where there's a lot of inflammation that's coming out, they think that that's what's causing some of the general joint inflammation. It's not you're just old, it's wear and tear. That's bullshit.
Yeah, it's multifactorial too. There's a genetic component. Some people are more prone to it, to degenerative joints. Dietary factors are huge. We're not eating enough foods with like we used to make soup stock, right? With all that had the natural glucosamine, chondroitin, and all that kind of stuff that helps support joints. Collagen, we don't eat near enough of that anymore.
Which
that we
all
used to.
Supports gut health also.
Yeah, exactly. Yeah. So it all kind of works together. Being significantly overweight isn't helping because that alone is a inflammatory. Yeah, absolutely. So poor muscle mass around a joint where the joint isn't getting support, you're basically putting a lot more shear stresses on that joint than you would having something well supported. It's like if you had, those old timey ship masts they have, when you see the thing called guy wires from them, right? You have the ship's mast and then you have the wires coming off of it to
those
support.
are those really big poles in the center of the ships where the sails come off of.
Oh yeah, that's right.
Yeah, they have supporting cables, because if you don't have those, all that stress from the wind on the sails goes right into the mast itself without support, and so you're going to have damage and eventually breaking of it. The same idea if you have poor support around a joint, including the spine, by the way, which is a series of joints. People are like, you see these people even my age already are starting to be that kind of humpback look and kind of just shuffling around, and you look at them and they have even if they're not morbidly obese, most of them are skinny fat where they have very poor muscle mass. You test their muscle strength on certain moves, they can't even activate, just basic movement. And that's a real problem I feel with degenerative joints too.
Interesting.
Well, so not to turn this into a gut health podcast, but how would one know that they had a healthy gut? How would they know they don't have leaky gut? How do they know their gut's good?
So, Bill, where are we back to?
I mean, we're going to start talking about poo.
We're going to be talking about poo, right?
Confetti butt, nutty butt.
Nutty butt, confetti butt. So if it looks like cow pies, confetti butt, rabbit turds, we're not good. Sausage.
Cigars.
Cigar poops, pretty healthy. My
stepdad, yeah. He would always talk about how his dog has good quality cigar poops.
I gave Bill a coffee cup with the Bristol stool rating system on it.
I scoop my cat's shit with it.
But someone could have normal, healthy bowel movements and still have gut issues, right?
Yeah, so if you every time I eat blah, 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 I get all bloaty.
Or if you have psoriasis or
eczema.
So
What does that have to...
That's a little low-level leaky gut that then is showing up as inflammation onto the skin. So bloating, frequent nausea.
What is leaky gut?
Intestinal permeability. So go back and listen to our whole lecture, whole podcast we did on the gut. And
he likes lectures.
I know. Well, you get indoctrinated in medical school. You have those tight junctions between each cell lining the gut, and they're not supposed to let things through. There's a very distinct mechanism through the cell that things are supposed to be passed through the intestinal barrier into the bloodstream. Those tight junctions, like joining row houses or townhouses together, they break down and things start getting through that should not.
Okay.
Like big particles of food that normally would have to go through the proper absorption channels, different types of bacteria, and that goes right through, and then the immune system sees that stuff and goes, that's not supposed to be here.
And that's when you can start seeing the psoriasis flare up. Or
if you guys want to look into this, people think that's crazy, like, well, how can my skin be related to my gut? Just Google gut-skin axis or gut-skin relationship. You'd be amazed about the amount of research there is on that.
It seems like most, if not major skin issues seem to be related to the gut. I know my mom said that she cut out gluten and reduced her sugar, and she was getting eczema on her chest.
Yep.
Went away.
Right. Exactly.
So
I mean, that's the same as kids, like, going to eat a bunch of sugar and going to get acne.
Well, and stress reactions too. Stress causes intestinal permeability as well too. And that's why you see a lot of people that are super stressed all the time. It feels like they can't eat anything without getting some kind of reaction. And it's because it's bypassing those normal mechanisms and it's reacting in the gut because of the intestinal permeability there. So stress is another component of that. And until you address the stress, this is where, I hate to use that term, but holistic, going into a doctor's office and say, hey, how's your stress? How's your sleep? All that stuff can affect your gut directly. It's not just this one thing. We've compartmentalized medicine so much. That we're forgetting to put all these pieces together. So you go to a dermatologist for your psoriasis or your eczema. Do they talk about gut health? No, it's preposterous, right? Yeah, exactly. But it's not fixing the damn problem. And where you can educate someone and say, hey, look, this is what's going on. If we work on this, the downstream effects of what you're seeing in your skin will likely go away. And so it just takes extra time.
Okay. That was a question for Carrie, not you.
Oh. Sorry.
Did he do okay?
He stepped on my dick. We're good.
So, if you would like to like and subscribe after that, it'd be great. And
hashtag.
If you have any follow-up questions, please.
Oh, did you want to touch on the...
Throw the comments on YouTube.
The getting choked out.
Choke out, yeah.
Yeah, so we had a comment. We touched on it on the GIF one because someone asked. They were choked unconscious in training, I believe. And I told them that I gave them a quick answer because they were a little paranoid that should I be looking for like symptoms?
Yeah, how long were they unconscious again?
15 seconds?
They think it was something like 15 seconds.
So
But I gave them a quick answer to calm them. But I said I would touch on it with you guys.
Yeah. The brain can survive without oxygen for 4 to 5 minutes.
Because their question was, do I need to worry that I was
damage.
choked unconscious? Is there damage? Should I not drive home?
No.
This sort of thing. Yeah.
No. No, not at all. You're fine. You just want to make sure you're not dizzy or anything. I mean, right afterwards, like I've had that happen to me several times.
You're welcome.
You have never done that to me.
I know Carrie has a couple times. Like,
She-
"Yo."
I've gotten close.
Very close with a clock choke where she didn't hear me tap. And
Actually, I think that was recently. There was one time.
it was pretty close.
Yeah.
So, and I was like, oh, I couldn't tap because I'm in turtle position. Yeah, I was almost out. But no, it's fine. I would just, you may want to like take a roll off,
Sure.
kind of sit down and make sure, get some water. And
So we had a
think you're
match at a tournament just 2 weeks ago. And shout out to our boys, Jeff and Nico.
yeah.
Teammates. They drew each other in the first round, which
By the way, and Nico ended up winning gold.
Nico,
And Jeff got podium too.
spoiler alert, but thanks freaking Chris.
Yeah.
But it was cool because they both haven't competed in anything in a long time. They're getting out of the comfort zone. They both started training, and one of them lands a baseball bat choke.
Jeff.
Okay.
No,
We're just going to throw him out there.
Okay. Well, we gave Nico the pub. He got first.
No.
after this.
So let's say how that baseball bat choke was set up. That's
So
more important.
It was starting from the standing position. Jeff already knew that Nico has a bit of an advantage standing. He was a high level wrestler in high school.
Yep.
And so Jeff was like, okay, if I'm gonna do something, I gotta get this dude right away. Well, we did happen to go over standing and then dropping down baseball bat chokes for a couple weeks in the old day class, and Jeff latched onto that. So Jeff sets up the grips and then just dive bombs down to his back. And Nico didn't quite understand what was going on, and then out of nowhere, gone. He just went unconscious. And Jeff heard the snoring, and the ref didn't even see it. Jeff lets go, and then Nico kind of rolls off to his back. Now, my question. Nico almost like spasmed
Yep.
uncontrollably. We don't always see that.
Yep.
A lot of the time they're just dead. You've done this?
Yeah.
I've done the funky
It's
chicken.
called the funky chicken.
Okay.
Yeah.
So where he was,
Chris got me.
Yeah. Yeah.
Bow and arrow choke.
I choked her out.
did
yeah.
you
Yeah.
urinate
Yeah.
yourself too?
No.
Oh, okay.
I just woke up giggling because I was kind of aware what was going on, but I couldn't control any of it.
Right.
It's your brain coming back online.
Okay. And
Yeah.
that was my question is,
Yeah.
does that signify something
No.
bad?
No.
Two, what the hell is it?
Startle response, and your brain's like, what the heck?
Because he like jolted.
I did the same thing.
times.
I did the funky chicken. So back up. I got choked out as a blue belt in competition with that same damn thing. So I have extra hate for this young man that
Which
did this
is
to our
why I
training
did
partner.
teach it in the day class.
I
And I
know.
referenced that you got choked out
You're
in that fashion.
you're a monster.
I am.
Yeah. So no, there's no the funky chicken is okay.
Okay.
Yeah,
Yeah.
you're all right.
It's just the brain kind of kicking you back.
Yeah, getting
Yeah.
y'all back online.
Yeah.
It's like, what's that Leonardo DiCaprio movie? Inception.
Yeah.
The music starts and just kick, kick.
Yep. Very much.
So he's safe. The guy is all good.
He's good.
Okay. Questions? Anything? Let us know on YouTube, Instagram, whatever. Email, grapplingwithpodcast@gmail.com. Thanks for hanging out. Olivia's going to start that music.
Later.
Later.
Deuces.